Well, hello, everybody. My name is Christopher Archiopoli. My pronouns are he, him, his, and I'm your host for today's King County Recovery Conversations. Special thanks to the King County Recovery Coalition, King County Behavioral Health and Recovery Division, and Orbit Audio for hosting us here. Today, my guest is Ro Yoon. Her and I have known each other for several years now. We've gotten to know each other professionally, and I know a little bit of your story, but I don't know all of it because you're a woman of mystery. And
Gossip.
You like to tease it out to keep us coming back for more. So, but, I've enjoyed getting to know you over the last several years.
Likewise, thank you.
I'd love to just start with, an open-ended, what's your story? Share with the folks that are listening.
What's my story? Well, first of all, I just want to thank you for inviting me. I think this is kind of an interesting time that we're living in history, so I thank you for this. But my story is I've been in Seattle for 25 plus years. How I got here to Seattle is I'm a military brat. I lived overseas for most of my formative years, and my father retired in Seattle, in Tacoma, which brought me here. But the deeper story is I came here to save my life. I'm a recovering addict. I was living in London, kind of messed up with my addiction with heroin, and I came to Seattle to not be the next one to OD or not the next one to die. So that's what brought me to Seattle. And I got into this work where you and I met through paying my karmic debts. In my time of London, through my addiction, fortunately for me, I was spared because I had really amazing mentors, albeit they're addicts like myself, but they really protected me from a time where HIV was decimating our community. So it was a bunch of fierce drag queens and trans women and men that really took me under their wing. And when they all died, it was my way of paying my karmic debts. So that's how I got into this work of HIV activism and prevention, is through that memory.
So, for those that don't know what you do.
Yes, sorry.
No, that's okay. I want you to, first I want to acknowledge your story and thank you for sharing it because I think you made several good points even in sharing that about, I think people discount, people, they're just addicts.
Right.
But, when I know this was true for me and it sounds like it's true for you, when we're living in that, we still have community.
Absolutely.
And that's a huge part of why people have a hard time leaving, substance use, is because we do have community. We do have people that we love. And often society is shaming us and stigmatizing us. So we choose to stay with the people who love us.
I agree.
So thank you for sharing that point. I think it's really important. But, tell us a little bit about the work that you're doing right now, because it is inspiring. And I think it's the type of work that people don't know is even happening.
Right.
Because it's so behind the scenes.
Yeah, I was lucky enough 10 years ago. First of all, my background, other than just being a survivor, I didn't matriculate and go to grad school or anything of that nature. So when I landed here, I was predominantly working with the very communities that was reflecting me. So when I first came to Seattle, I was working at youth care as a case manager for young people living with HIV. I worked at a lot of nonprofit organization that was doing a lot of prevention work, like Props to Gay City Health Project, which is now the Seattle LGBTQ Center. And a lot of partnership. But right now I work with the Vaccine Trials Unit, which is a small clinical research clinic that is part of Fred Hutch and University of Washington. It was one of the first clinical research sites in the nation to do HIV vaccine research. And I signed up 10 years ago because of my access to communities, and also taking on that charge of making sure that these clinical research studies see the diversity amongst the volunteers who have been using their body for science to support such a honorable but like a lengthy journey. And it has been instrumental in really giving all of us some insight about what our immune system is capable of through the volunteers, either living with HIV or people who want to contribute to that effort. So I'm lucky. I'm lucky I get to meet altruistic folks who really believe in something greater than themselves. And I feel like my experience with addiction comes with that commitment of wanting to see something greater for us all. You know, I think that you meet anyone with addiction, whether or not they feel right at that moment in time, they're always looking for other people, thinking about other people. And that was no different from me. So I was representing very much the marginalized community that clinical research studies have had a challenge. You know, I mean, as a trans woman of color, I know that HIV has impacted my community dramatically. I mean, over 50% of women of color are living with HIV. I saw that through my addiction in London. I continue to see that here in the United States and here in Seattle.
Yeah, I mean, I think that's an important point, because people, I think they think, one, that HIV is gone,
Right.
because the medications have gotten so good.
Absolutely. And they're great. Thank you.
Thank you,
Thank you,
science.
science.
I'm a person living with HIV since 2008. I credit, I take one pill once a day. I go to see my
Absolutely.
doctor twice a year. I mean, believe me, science saved my life. I'm eternally grateful. I'm also a participant in one of the VTU
Thank
studies.
you.
So, I believe in what you all are doing, and, I want to give back. But I think like the important point that, another point that you made was about the demographic impact
Absolutely.
of HIV.
Right.
I think people still have this misconception that like it's just, gay men that get HIV.
Absolutely.
This is a gay disease. I don't have to worry about it. It just impacts those people.
Right.
What is the reality?
I mean, to mention that is to really put voice in how stigmatized HIV continues to be. And it was so easy in the first wave of the pandemic to demonize gay and bisexual men, even knowing full well that there are other marginalized groups that were impacted. And if you recall, like the first wave, I mean, it took everyone to even remind that women were at risk. And to this day, over 50% of those living with HIV are in fact women, which includes trans women, but cisgender women.
Yeah.
And I think that if you kind of take a global perspective, you will see that it is more than just sexual orientation. It is. And we also kind of look through the lens of social determinants of health. There are other factors, oppressive factors that compound that vulnerability. So, as you mentioned, with the stigma that's related to HIV, you're seeing it kind of incorporating not only people of color, but sexual minorities, sexual orientation. I think one thing that's really tragic, and I'll quote, there was a filmmaker, The Other City, that was looking at the HIV epidemic in DC. And if we looked at DC as a country in itself, it would have the highest prevalence rate. And he said that AIDS is humanity's greatest failure in the way that if we can't talk about who we are and our relationship with other people, how would we even address the stigma that is perpetuating or reinforcing the impact of HIV and AIDS?
Yeah, that's a huge challenge. Because I think in this society we like to other people.
We do.
We like to think that the problems are happening to somebody else,
Right.
and that we are somehow above them as an individual.
Right.
Like, oh, that's not me, that's them.
Right.
and I've talked about this empathy deficit that we seem to have as a society,
Mm-hmm.
where it's difficult for people to care about someone that is not themselves or is not their demographic.
Mm-hmm.
How do you think that we get past that? Or at least make progress on it? I mean, maybe we'll never get past it.
Right. That's a great question. And as a woman who's transitioned probably in the last 20 some odd years, I walked through this life navigating as a queer man. And it was that community that really indoctrinated me to some special skill that has to this day made a huge impact. And one of them is taking an asset-based approach. We live in a society, as you kind of stated, that it's a deficit model. We're always told that we're not good enough, smart enough, attractive enough, young enough, all of these things reminding us that we're less than.
Mm-hmm.
And it was through the early wave of, HIV prevention, but also the liberation of queer folks and having some autonomy as gay men to take this task on. To take the asset-based approach really was revolutionary for me. Instead of thinking about what's wrong with my communities, I think of like, what are the community-based solutions that has really kept us resilient?
Mm-hmm.
And I think one thing that I will really make mention is that, with the AIDS epidemic, ACT UP was one of the most influential health movements, and Times Magazine has quoted as saying it's one of the most influential health movement in our history, where when the government didn't even want to share with us how and what and why, that we as the community that were most impacted and burned by this took it upon ourselves to reach to one another and build skill set that allow us to not demonize one another, but to care for one another. So that means, all the women and femmes that took care of all the dying gay men. It meant all of the physicians in the hospital who didn't want to touch anyone living with HIV or at that time who was diagnosed with AIDS, but it left for other marginalized folks like women in the workforce, women in healthcare, queer people who are just as outliers, activists, stuff to really come into play and be the active participant in this movement. And that really came from asset thinking. Like, what do we bring to this conversation? So I think that when we think of gay liberation and we think of sex positivity, albeit it's not across all the diverseness of that, rainbow coalition or rainbow community, but it started somewhere.
Mm-hmm.
And I like to hold us accountable and say that when did we share those assets or those skills or those tools to other communities that are at that same situation? And that's where things missed a beat, right?
Mm-hmm.
Where heterosexual transmission of HIV has been consistent throughout the beginning of the pandemic.
Mm-hmm.
How we consistently see Black and brown people, how we consistently see younger folks. So there's something to be said about what we use as a community mobilization technique as asset-based, but how do we share it beyond our own community that look like ourselves? And that's the next thing, not the next thing, but one of the things that we need to commit to.
Yeah, I think that, you and I have talked outside of this room about that.
Right.
Like, how do we
Right.
make people care
Absolutely.
about what we're going through
Right.
and what is going to impact our lives and our health?
Mm-hmm.
Because, through that process of othering and through that process of not caring and not being empathetic, people just write us off
Right.
often.
Right.
What type of messaging do you think would work? How do we connect with rural communities, people, conservatives in red states that are humans too and,
Mm-hmm.
do have hearts? How do we get across to them that this is about more than just us? It's about them also. Because I think that to build a movement, we need more.
Right. When you said earlier about the idea of empathizing, it's really funny that when I hear that word, I always think about it through my cultural lens of being a Korean American immigrant and that experience of being othered and going back to asset-based approach, I felt like that upbringing of being Korean American there's some fundamental things about that culture that forces you to consider other people before the individual. So I was already indoctrinated in a culture where I had to think about other people before I thought about myself. So, and that would kind of explain why my love language is to be of service, because I need to
Yeah.
think about other people. Now, I'm not saying that Americans are inherently selfish people, but I feel like there's we celebrate in America our individuality. You know, we talk about the idea of authenticity, which is kind of at the risk of not conforming to the general society or the expectation of others. And I only bring that up because I hope that the power that people have as Americans or Westerners who think that individually they're unique, that could transcend to when you meet people, there's something unique about them that you can't see beyond what they look like or what they say, you know? And I think that is like one of the kind of the seeds of empathy is when you're curious about the experience or daily lived stories of people who don't look like you. And I'm also the person who like to get clarification. You know, oftentimes we as shy people like to oversimplify our life, and that is not very nuanced. So my curiosity, my asking questions of people that I'm interested in, whether it's work or not, allows me to get a further understanding of them and therefore feeling a little more connected and therefore maybe thinking of their best interests as well versus just my own.
I mean, do you think it's possible to reach people that are so different, you know, and where, you know,
Yeah.
outside forces have made us think that we're more different than we are?
I think we are more than capable of that. I mean, we see those examples in our own respective community, right? Like how did we find our people and I mean, I always tell people communities where you go learn things, you heal. It's a resource, but I also think community is born out of necessity. If there's no shared experience or shared value, it's really hard to find the nugget, the introduction, the kind of like the door to walk in. And I think in regards to our work, because it's related to stigma, it does require us to understand where that stigma comes from, maybe the misconceptions or the baggage that we hold on to, like the trauma. As someone who survived addiction, I still get triggered. You know, those awareness is what keeps me stable, keeps me on point. And it's the same way that I could think of my relationship building with other people. I want to learn a little bit more about who they are and why they are so that I could take that into consideration as I'm building my relationship with them, you know?
So you've talked about, well, you've talked about one historical
Yeah,
event explicitly, and there's
right.
one that you've alluded to that I want to get
Yes,
to
okay.
because I think it's important. But you know, let's talk about ACT UP,
Let's do it.
and let's talk about, you know, what happened in the 80s and 90s.
Yeah.
You know, the government was ignoring the AIDS epidemic,
Yeah.
basically killing us. You know, Ronald Reagan, you know, is complicit in many ways
Absolutely.
in our death. And so, you know, ACT UP and other movements sprung up around this.
Right.
And you talked a little bit about ACT UP, but I bet a lot of people don't know what it is.
Right.
And that it's still also around. I mean, it's still an active
Absolutely.
movement.
Absolutely.
Do you want to provide a little bit more
Yeah,
background?
I mean, ACT UP, it's an acronym that stands for AIDS Coalition to Unleash Power. It was, although there are many founders of it, it's not a singular person, but Larry Kramer was one of the really outspoken person in media. And long story short, for those who don't know Larry Kramer also is a playwright, but also was instrumental in developing a relationship with Fauci at the time when he was at the National Institutes of Health. And why that's so important is it has built this relationship with clinical research to understand the importance of having impacted communities to be participating in that. But going back to ACT UP itself, ACT UP, you have to remember it came at a political time where LGBT folks, trans folks, women even didn't have the, I would say, the protection that we think about today. Obviously, to be gay was not something that was socially acceptable. So to hear about something that was impacting that community, we were considered expendable. No one gave a shit about us. So therefore, hearing about the devastation of AIDS with a bunch of homos, like, why would anyone care, right? Well, that was the sentimentality. But what ACT UP did is it took those very folks who were at the front line, whether they were living with AIDS, living with HIV, or being caretakers or whatnot. They basically took that time to really see what the surrounding, what the government was doing, what was community doing. And it was a democratic process where these ACT UP meetings was open to the public for anyone to come in. I was part of the London chapter, which is right in the beginning, and we use ACT UP as an activation point. My very first rally was going to the prison and throwing condoms over the wall because, and it still is to this day, where condoms is contraband in prison. But at that time, we knew that there were a lot of people living with HIV that couldn't access, or at that time didn't have any medication anyway, but we knew how it was transmitted. We were trying to provide resources to even stop that, even amongst people who are in prison, and that's
Right.
London,
Yeah.
But if you look at New York, where a lot of the activation, you're talking about women and lesbians really advocating the attention, because AIDS diagnosis looked very different in those born with vagina versus those who are male. So like even the definition of AIDS was very different based on gender. So like ACT UP really was a community mobilization effort. It was a politically charged because our lives were at risk, and not that we made our identity political, the government made it political. And I think one thing that's very clear in my eyes that AIDS movement or the ACT UP movement really benefited the rainbow community in the way of coming out or having a personal story that others never knew of us. And therefore now starting to hear our personal stories and therefore giving a shit. So I think like the National Coming Out Day on October 11th, all the visibility days that we see right now, I don't take those for granted. They were designed specifically to destigmatize the very population, the very communities that oftentimes get the short end of the stick.
Yeah.
So,
Yeah, and representation at this point, particularly has always been important,
right.
but I feel like particularly at this moment, representing, sharing stories, as the government doesn't want to acknowledge, Black History Month or Women's History Month or Pride Month
Absolutely.
anymore.
Absolutely.
Getting that personal connection out there is really important. What do you think are some of the lessons that we can learn from ACT UP that we could apply to what's happening now as the government again wants to see us not do well?
This is something that you and I had conversations about. What does activism look like today? And I think one thing that ACT UP really demonstrated to me is showing up, physically showing up, because power in numbers was even more clear at that time, where no one wanted to put their neck out there as being not only LGBT related, but whether it's HIV and the stigma that's associated. We call it courtesy stigma, But I'm sorry, I lost my train of thought.
No, that's okay. Asking about what lessons we can learn from ACT UP.
Oh, yes.
Yeah.
So showing up is definitely one aspect that I took away from ACT UP, using our body as a way of defense, but also using our body as power. And I mentioned our conversations because, we live in a blue city, blue state. And oftentimes I know that it's very progressive in thought. So are we moving the needle in any way? But my argument from ACT UP is that if you show up, regardless whether you're in a progressive or not, it is a visual representation that does not happen in other spaces where it can't happen in other spaces. So I think that is one lesson I learned, is that you show up when the community needs you. Doesn't matter how, you just show up. So that comes with like any other health movement or any social movement, whether it's Black Lives Matter, people showed up. That made a huge difference, regardless of the political climate. The other thing is also having a unified message, so the chant, ACT UP, fight back, fight AIDS. At least it got people to understand what is the common message that we could then share to the world. So if they can remember anything, it's the chant. And I think that is a more tricky situation right now, because we're not just talking about, identity politics. We're talking about much more. We're talking about science, funding, all of that. So the chaos that we're experiencing right now, I don't think could be solved with just showing up.
Right.
But it does it does require, what do we have to lose at the end of the day? And I think that could be the reflexive lesson, is that what do we have to lose if we don't do this? What do we have to lose if I don't show up? What if I have to lose if I don't have the message that I need? And that is enough fire under my butt to do something.
Yeah, because we have a lot to lose.
We do have a lot to lose. We're losing it already.
Well, yeah, we've lost a lot of it.
Absolutely.
So, I mean, in some ways, this is, an offensive, a defensive battle that, we have to try to get something back, but it will never be quite the same.
It won't.
So, sort of a two-part question.
Yes, please.
Why should people care, and what can they do?
So when you're asking the question, why should people care about clinical research or just HIV in general, is like,
Both.
Yeah, I think first, clinical research, I can't minimize the importance of clinical research, because it is the evidence that you need to drive either to a product that will be given. So for example, a lot of people don't know that 99% of the drugs are NIH funded. 99% of FDA-approved drugs have been in research because of National Institutes of Health. And that research process is not short. It's really lengthy. So for a drug to go out right now for you to access has been in clinical research for maybe 5 years, 10 years, depending on it. And if we stop that train now, even if we were to go back to it after a year, that momentum is lost. And I'll just use the example of vaccines, since that's my world. WHO, which was funded by the federal government sometimes, like they, it took 6 months to even develop a flu vaccine, a flu shot that's using the surveillance data of what's circulating in the world. That coordination with other countries to kind of figure out what we could build together that impacts everyone, that is a clinical process. So by withholding the funds, withholding the resources, with basically demonizing scientists, nothing else is going to save us. If you take science out of it, there's no proof of safety, there's no proof of efficacy.
Well, I think that's the point that we have to figure out with messaging.
Yes.
Is how do we connect people to this idea that science impacts everyone? Like, to your point, like 99% of drugs,
Right.
Are NIH approved, which means that almost 100% of America has taken one of those drugs.
Absolutely. And I think that's one of the reasons why they're going after all the health organization, because then we won't be accessing what is all our health disparities or the health woes that Americans deal with, right? Very clear that, from obesity to chronic diseases to cancer, at the end of the day, treatment, medicines, all of that stuff is going to be tools to combat it or to address it. And if you eliminate all of those together, we don't even know what to look for.
Right.
We don't even know how to connect the dots of your back pain may be related to a viral infection versus just you working out wrong.
Right.
So it is that methodology of science that help us understand, why are we experiencing symptoms and how do we prevent it and what can we do to help others?
Yeah, it seems I'm not quite sure what the end goal is in making people less intelligent. By by killing people off and limiting science, limiting education. Really like the long term impact of that really just makes this a worse place, not a better place, not a greater
I
place.
agree. I agree.
So there's one more topic that I
Yes,
want to get
I would love
to,
to.
as we wrap up. Sort of not connected to research, but you mentioned, thank you for identifying as a trans woman of color,
Yeah.
and opening up that topic because I do, I'm wearing my Stonewall shirt
Yes,
today,
of course.
and you also talked about the importance of lesbians and women in the AIDS movement.
Right.
So I think one, I'll just make a statement. I don't think a lot of people know that the L in LGBTQ is there for a reason. It's the
Absolutely.
first letter for a reason
Absolutely.
because they saved our lives.
They
They
sure
saved our
did.
butts.
They sure did.
They showed up, they took care of us, they made sure that there was someone at our bedside as we were dying. And, the importance of lesbians to our movement, to our community, to our movement, is often understated.
Yes.
So I don't think a lot of people know that one.
Right.
But two, I want to talk about Stonewall and I want to
Yeah.
talk about the Pride movement.
Right.
And we don't have a ton of time.
Yeah, it's okay.
But
I love it.
because we could have a whole episode about that.
Absolutely.
But I want to acknowledge that like without trans women of color, like the modern Pride movement doesn't exist. Stonewall didn't happen. Stonewall was the impetus for Pride and, the civil rights uprising of our community. For those that don't know what Stonewall is, would you mind talking about it briefly?
Yeah. I mean, Stonewall happened in 1969, but, to be factual, there was a trans-led movement that happened a couple years prior to that at the Compton's cafeteria in San Francisco, which was basically trans women uprising against the Tenderloin cops. But both of them are examples of the most marginalized folks who have nothing to lose and getting tired of the fuckery of being policed. Because remember, 1969, in order for someone to cross-dress was illegal. So that meant any, drag queen, but never mind any trans woman or trans masculine person because they were doing something deceptive or stealthily was illegal. So it made sense that the folks who were just fed up were those who had nothing to lose. And that is why we see the respect to trans women of color or those who are gender nonconforming that basically popped off. And that's what happened in both situations with Compton riot in San Francisco, but also the Stonewall riot in New York. They were both, the precipice, the precipitating event was the same thing. Cops going there policing, and we said, we're fucking tired of it. Now, am I saying that gay men are chicken shit and they couldn't do it? No, but they had more to lose.
Right.
That's what comes with male privilege.
Yeah.
And that's why when you say that lesbians, the femmes or whatever, at that time of history, they got nothing to lose. They were already the one with the short end of the stick.
Yeah. And I think, not enough people know that,
Right.
because when we're talking about the transgender community, we're talking about 1% of the population that is deeply misunderstood.
Absolutely.
And, is marginalized and picked on. And, right now, and I'm not going to use this, I don't think this word is hyperbolic, there is an active genocide happening in this country against that community. And it's starting slow.
Yeah.
It's not camps and death yet,
Right.
but there is an erasure happening, and that is the beginning of a genocide.
Absolutely. I mean, trans people were not naive to the violence. Even before this administration, trans folks were victim of violence through hate crimes and so forth. So this is what I'm saying. Trans folk, this is not the first time at the rodeo.
Yeah.
But what makes it different is before we were invisible, but for whatever reason, politics are so obsessed. They want to fuck us and kill us at the same time. So that attention makes us more visible, yes, but also comes with the fraud of like, well, Jesus, everyone knows my story, and why is everyone fixated on it?
Right.
Where majority of trans people just want to live their lives in peace, left
Right.
alone.
Well, and that's why it's our time to stand up with you, because,
Thank you.
I think that, now we all have something to lose. We all have a lot to lose.
We do.
And, I respect that, most trans people do just want to live their lives. They don't want to be out in the streets and having to identify all the time. And I know I'm happy to stand up, and, it makes me sad and angry and a whole range of emotions to see what's happening to everyone, but in particular, picking on the most vulnerable people is just ridiculous bully behavior. It's weak, it's cowardly, and, like taking, this administration has taken mentions of transgender individuals off of off of Stonewall.
Sure.
Stonewall didn't exist without trans people. So
Sure.
taking that community off there is erasing history. And they've done it in other places, and they'll keep doing it. So
Yeah, I mean, I want to
Thank you.
acknowledge one thing, and that is lookism has played to my benefit. That is a privilege that I recognize right here as I sit here. When I tell my story as a trans woman or doing this work, everyone sees a package and it's more palatable. And I mention that because as an addict, as someone who was overlooked for so long, I want to remind people that it doesn't matter how attractive or how functional or how presentable someone is. I don't think that we could only look to those who are visible to make that decision or to make that change for ourselves.
Mm-hmm.
I think of the most vulnerable people in every community, and that includes addicts, those who are homeless, and all that stuff. And I would beg the question, if everyone could say Marsha P. Johnson, the importance of it, there are Marsha P. Johnsons living in this world right now who are overlooked, who are not even given a second thought. So it really begs the question, when we are activated, who are we doing it for? And it just can't be dictated by lookism.
Yeah, I think that's a great point, and it's it's true in all communities.
Absolutely.
But I definitely see that in my experience with trans friends, and
Absolutely.
seeing that community impacted by the choice to be stealth versus and the privilege to be stealth,
Sure.
and like there is a lot of privilege in that ability that not everyone can enjoy. So. Yeah, we could talk about all of this for a very long time.
I appreciate you bringing it up.
yeah.
Thank you.
So if we have to wrap up,
Yes.
but I want to give you an opportunity. Is there a closing message that you want to leave folks with? Anything that we didn't get to that you want to make a brief elevator pitch?
I just want to say that your silence is complicit. This is the time where we just cannot rest on our laurels and think that someone else is going to be using their body in the front line and do this. And as it relates to trans vulnerability, it doesn't need trans people to save trans folks. We need everyone. So I think, again, my message to everyone is silence is complicit. You need to get your butts out there. You need to scream, because even with the loudest screamer right now, we're not even making an impact. So,
I think that is a fantastic message. It is, silence is complicit,
It
because we don't have time to be silent right now.
we don't.
Yeah, it's that poem from Germany. First they came. I don't remember it all, so I won't try.
Right.
But I think it's called "First They Came."
Right.
And so I think that's something to remember and take to heart. So, well, Ro, thank you. I learned a lot about you that I didn't know. I knew that you were amazing, and you've just reinforced that for me. So I really appreciate your vulnerability and taking the time to share your story.
Thank you, and I'll interview you next.
Okay, I'm down. I'll be in the hot seat. I'm happy to do it.
I love that.
All right. Well, thank you everybody for listening and watching. This has been King County Recovery Conversations. Thanks again to King County Recovery Coalition, King County Behavioral Health and Recovery Division, and to Orbit Audio for hosting us in the studio. Have a great day.
Bye, everyone. Yay.
That was great.